Hi, this is Dr. Bonillas. I will be showing a video on lip augmentation and rejuvenation using Juvederm XC. I get many patients that come in and tell me that they will never ever do this because A, it was too painful and traumatic with their last injector, and B, they got what's called duck lips, or the augmentation was just not a very good result. I usually have to convince them that with my technique, they will feel little to no pain, and most of all, they will really love their lips because it's not about just augmenting the lips, it's actually about shaping the lips and providing a nice shape or enhancing their natural shape. I do dental blocks to provide anesthesia to the lips. This usually numbs about 98-99% of the lips, and the remainder is usually handled with the XC version of the Juvederm, which has lidocaine in it, so it really provides a nice, comfortable, and really pain-free procedure. This is our patient for this demonstration. You may notice that she already has nice full lips, and I will say, well, it's not about augmenting or making her lips bigger, but more importantly, it's about bringing out her natural shape and augmenting that shape so that she has much nicer, shapier lips. I start the procedure by performing dental blocks, which are actually pretty comfortable for most of my patients. This here, I'm providing a upper dental block, which will numb the upper lip. And then I perform the lower dental blocks, which will numb the lower lips, as shown here. And then I assess to make sure that the dental blocks were effective before I start my procedure. The lips are then thoroughly cleansed. I start the injections by placing Juvederm fill within these vertical columns of the upper lip called the philtral columns, and these are vertical columns of the upper lip which are part of the Cupid's bow, and this augments and shapes this area. I then move to the upper lip where I start the filler injection, and at this time, this is where I'm augmenting that shape of the upper lip. I'm not necessarily just augmenting the lip, but I'm doing more of a shaping to the upper lip. I also do a little shaping and molding of that product to provide and give me that upper lip shape. I continue to add filler until I start to bring her natural shapes out, and I add filler into her Cupid's bow area to enhance this region. And I shape and mold the product. Here you see the difference in the upper lip between the treated and untreated side. I then move to the opposite upper lip and I start my filling and shaping of this area. Here you can see how comfortable the patient is, and she is not feeling any pain whatsoever. And again, after my injections, I shape and mold that product right into that upper lip. I now start my injections and my shaping of the lower lip, and my goals for the lower lip is to provide a nice pouty lower lip, which is going to eventually be slightly larger than the upper lip. Now moving to the opposite side of the lower lip, I continue with the filling and the shaping of this side. Here's where I really start to shape that pouty lower lip by applying filler within these areas. You can start to see that her lower lip is taking a nice pouty shape. I then inject a little filler within the angles or the commissures of the lower lip to provide a little support to keep that angle nice and lifted. I then assess all the areas that were filled, and I check to see what areas need more filler. After all the filler has been injected, I then start my shaping and molding of that product within the upper and lower lips. I then cleanse the lips and place soothing cream and perform all my final shaping and molding of the upper and lower lip until I get the shape and look I desire. And I also make sure that there are no lumps or bumps or nodules that may be present within the upper and lower lip filled areas. And here you see the before and after. Here's an example patient in which I performed a lip shaping and augmentation using a syringe of Juvederm XC, and you can see that the result is very natural. It really enhanced her shape and did not give her duck lips. Here's a second patient in which I did the same procedure, and you can see how her natural shape has been enhanced and the shape to her lower lip was improved by adding this filler material and shaping her lips as opposed to just augmenting her lips. Well, that concludes this video demonstration. I hope I was able to show you my technique in lip augmentation and shaping, but more importantly, I wanted to show you how comfortable it can be for the patient and also the natural results that can be obtained with my technique. Thank you very much and see you next time.